All right, everybody, welcome back to the show. On this episode, we have a very special guest, Agnes Weber-Trzaska. Agnes, how you
Yeah,
doing, ma'am?
I'm good. How are you, Rich?
Great, great. Like we were talking about off camera, I'm excited to get to know you and how you help people. So with that being said, can you tell us a little bit about yourself and what you do, please?
Yeah, absolutely. So I'm Agnes, and I'm a licensed clinical social worker, and I really focus on kind of depth-oriented therapy. So I work mainly with adults and people who maybe have been in therapy for a while, and maybe things are just kind of not budging, or people who are looking for a little bit more, or feeling kind of stuck. So maybe someone who's been in therapy, or maybe someone who's just kind of ready to jump in. I kind of tend to go deep, and that's what really kind of helps us process a lot of stuff. So that's kind of my jam.
Awesome. Yeah, thank you for that. And Agnes, what's your demographic? Like, do you see kiddos, adolescents, adults? Like, what does that look like?
Yeah, so primarily I see adults. I would even say 30s and up is my kind of targeted population. I have worked with kids as young as 5 and teens and young adults in the past, but for some reason, the 30s plus really resonates with me.
Got it. And what are some of the concerns that they show up to your practice needing help with? Like, what do they have that's going on?
hmm so I work a lot with PTSD and trauma, anxiety, depression, also kind of dissociation, dissociative disorders, complex trauma, eating disorders. So I kind of work with some more complex cases too, and grief as well.
Got it. So it sounds to me like you really help a wide range of people out there. Does that sound about right?
Yeah, it's pretty wide.
Pretty broad. Yeah. Agnes, so how do you ensure that you're a good fit for the client and that the client is a good fit for you?
hmm So I actually do emphasize that quite a bit, and we're going to have a conversation about that in the first session. And right, it's going to be something that we might just feel right off the bat, whether something feels organic or not really organic, right, in session. And we'll really talk about that because it's so important for it to be a good fit. Because if it's not, then how can you do deeper work with someone who maybe you're not fully feeling comfortable with, or there's just something we're not vibing, we're not clicking. So if that's the case, we'll talk about some other options I might refer out, but that fit is really important both for me on my end and the client's end. So that is something that's addressed in the first session. um, and I think the good fit piece would be um, someone who truly is ready for some depth. And it's okay, right? If someone's not, that's not always the right time and space. We could potentially do some other work, but if someone wants just kind of coping skills and something lighter, I might want to recommend to someone else, mainly because I know myself and I'm going to be slipping into that depth oriented therapy. So,
Hmm.
right. And sometimes that's just not what people are looking for. That's just not something that they want. And I have tried to keep it light and I just slide right in. So I do give that warning to people right off the bat too, that it's like I tend to kind of go with like very depth oriented questions. I'm really going to pull some things out, really work on that deeper level. And it's just not the right time for some people, and that's okay.
Yeah, and that depth work can really uncover a lot, right? And so, and I'm really glad that you are transparent about that from the beginning, because, like I said earlier, it could be a lot and very overwhelming for individuals who may not have the basics set up to be able to kind of handle that. So thank you for that,
hmm
Agnes. Let's say a client reaches out and they seem to be a good fit with you, and you are a good fit for them. What does the first session look like?
Mm, well, really, I really would want to kind of get to know them a little bit, but also really try to understand what they're coming in for and what they're trying to get out of therapy, right? What's the end goal? Because I really look at therapy, and I'll probably use this analogy because I really like this analogy of I see the client as they're in the passenger seat. I mean, I'm sorry, they're in the driver's seat. So the client is in the driver's seat. I'm in the passenger seat. And the goal of therapy is that I'm no longer in the car, right? That's the goal because they're going to know where to go, how to get there, and just be good to go all on their own. So that is kind of my goal for my clients in therapy. And So I really want to know what their intentions are, what they're trying to get out of therapy, and also what they're coming in with, right? And sometimes people come in with certain things, we learn new things, and we also work with that as well. But once in a while, I'll actually check in on the progress and the goals to be like, hey, are we headed in the right direction? You know, where are we at? Where are we still going? Do we need to
Yeah.
pivot? Sometimes that happens, but so yeah, I'm pretty kind of direct and straightforward, and just want to get to the root, want to get to the intention, want to get to the destination.
Yeah, and I appreciate you sharing about the feedback, because feedback is so important in therapy. And I'm really glad that you're consistently touching base with the client, because we want to make sure that we're doing good by them, right? And that is delivering good service, that we're on the right track and accomplishing the goals. So thank you for that, Agnes. With that being said, there's a lot of specialties out there. We have CBT, DBT, EMDR, on and on. There's like hundreds out there of modalities or specialties, or however we want to call them. For somebody that maybe doesn't know a whole lot about the mental health field, how would you describe your specialty?
Mm-hmm. So I specialize in brain spotting, and I could explain what that actually means and what that is. But it is, again, depth-oriented modality where we kind of work with that deeper part of our brains that's more connected to kind of our emotional content or memories, things that are stored in the body. So that's kind of my first specialty, but I also incorporate kind of parts work. It's called internal family systems, if anybody's curious. But we really kind of learn about these like deeper sides of ourselves and these deeper parts. And as we learn about them, we get to really understand ourselves a lot better. So those are kind of two primary things I specialize in. And yes, I'll throw in some DBT and, CBT and kind of a little bit more of the talk therapy, but those are kind of at my core.
Awesome. Yeah, that makes sense. Agnes, so let's say somebody partners with you, they do the first session, everything seems to be a good fit, and then they start doing the work. What does progress look like?
Well, if we're actually utilizing brain spotting, progress can be really seen from one session to another. Let's say we're working on an issue that we are processing in one session. And let's say someone's like, I really feel anxious every time I walk into the conference room at my job and I'm about to speak. And let's say we work on that. And then what progress will look like the following week, I'll follow up and check on that. And let's say, I'll ask someone, how was it when you walked into that conference room and you had to give that presentation again? And I want to say 9 out of 10 times there's some kind of a reduction or shift in someone's anxiety levels. We might not get it down to 0, but we might go from like an 8 to a 4, So when we're doing brain spotting, the shifts can be seen very fast. If we're not, and we're going a little bit at a slower pace, the progress that I see with my clients right now is I love to empower people. So I do see people more confident, improved communication, reduction in anxiety, reduction in depression. And when working with with PTSD and trauma, definitely reduction in whatever symptoms are kind of coming in from that.
Wow. Yeah, that's awesome. I like to shift gears a little bit and ask about your style in session. And let me elaborate on that. So there's some clinicians that are very solutions focused, right? They're like very direct, like let's get to the end goal and get you out of here as quickly as possible. Others are more laid back and they let the client lead. Some involve humor, some don't involve humor. Some are, they do a lot of self-disclosure. Others don't. They keep it very professional. How would you describe the overall vibe or the spirit of therapy with you?
Mm-hmm. That's a good question. I would say it's pretty collaborative because we do work together, but I do let the client lead because I will never be an expert of somebody else's life. They are the expert of their life, right? And remember, I'm in a passenger seat, but we also collaborate and work together to get to that destination. And I do use humor a little bit. A lot of times, some of my clients already know I'll kind of preface things with, you might not like me right now because of the feedback I'm about to give you, or hey, this is not going to be easy to hear. So I do give feedback to clients a lot, and I'm also kind of pretty direct with what I'm observing, because I feel like that's more beneficial, even if it's hard to hear. So yeah, pretty collaborative and direct at the same time, I would kind of say would be my style. And, I like to think outside of the box too. So everybody's so different. So if I can somehow get creative in that space, I will. Which is like, hey, you want to try this? Let's try something different. And I also do some like somatic exploration, right? Which is kind of has to do with like really gaining some insight into like your physical sensations and getting kind of know what's happening in your body a little bit more. And sometimes that might be something that people don't expect, but I'll be like, hey, why don't we try something?
Oh yeah,
So,
that's awesome, Agnes. Yeah, that's really cool to hear. It sounds like you approach it with a lot of nuance, right? Like what's appropriate and for the time with the client. So that's really cool.
mhm.
Agnes, I wanted to ask, how do you know if somebody is ready to be done with therapy? Like if they're ready for termination after they've done the sessions and they've done the work with you?
Mhm. Um, I think a lot of it is a felt sense. Like you're just kind of know that you're done. And my guess is a lot of clients are kind of thinking about it in the background a little bit. But how will they know that they're done is that when they're coming into therapy and there's just really kind of not much to bring in from week to week or every other week. And that's kind of how you could kind of tell that, I don't really have much going on because things are going well. And I am getting places. I'm driving on my own. Like, hey, it's been cool to have you in a passenger seat, but I think it's kind of time that I got this. I can drive solo. And so that's one way when clients can kind of really tell. Another thing that I have noticed is that clients might feel like they're ready, but they don't really know how to approach it. And I'll usually feel it in a session and I'll bring it up. And I have done that before. And the client is usually relieved that, like, oh, yeah, I've been thinking about it too. Right. I'll kind of let them know about the progress and see how they feel about either pausing therapy, ending therapy, or maybe we want to kind of titrate down from weekly to every other week and slowly do that. Either way. So if I sense it, I'll say something and I'll put that out there and we'll have a conversation about it. And, or if they bring that in, we kind of have a conversation about it, how they see that termination going. But they'll know, right? They'll feel more confident. They won't really have things to bring in. And
Yeah, no, yeah, I get it. And so like let's say somebody terminates, and then maybe a few weeks or even a few months, they have something else happen in their life and they need more support. Are they welcome to reach back out to you to get that support?
oh yeah, absolutely. I'm actually pretty flexible. So when I do, we do finish up therapy, I do mention like, right? Because some people are hesitant too. They're like, oh, what if something happens? And I'm like, well, then you have my number and you reach out and we could do just one session or we could do a few sessions. I'm pretty flexible. Just reach out and we'll go from there. So yeah, they're absolutely welcome to come back.
Awesome. Agnes, if somebody is liking what you're saying, they like your style, the way you present yourself, and everything that you're saying right now, and they want to reach out, but maybe they're reluctant because they've never seen a therapist before. This could be a whole new experience for them. What would you want them to hear?
Hmm. I I know how hard it is to start therapy. I mean, just my personal experience, and I'll tell you a little bit about it because I think it's so real for a lot of people, and I know it could be so hard to take that first step. I knew I needed to kind of go to therapy, and it took me about a year to actually arrive and get there, right? Because something comes up, and you're like, okay, I got to look into therapy, and you kind of look, and then things settle down, things get better, and you forget that you're looking for therapy, and then things resurface again. It's like, oh, I got to get to therapy. So that, at least that was kind of my progress. That was my story. And eventually I found some therapists. I had their tabs open, their profiles open for 3 months before I reached out, right? But at that point I had the tabs open. So next time something popped up where it was like, okay, I got to look into therapy, at least I had those tabs open and I messaged and I reached out. So the first step is the hardest. If kind of yeah, the first step is the hardest. And if you could just kind of get yourself to reach out and say, hey, this is kind of what I'm going through. Is this something that you could help me with? I will give you, direct feedback. If it's something I'm truly um, not working with, I'll refer out, or I'll give people directions to go into. But if they feel like that we might be a good fit, then we just do a consultation. It's like a 15-minute consultation to see how even that phone call might feel, or we do a Zoom, whatever kind of feels better for that person, and we'll just go from there.
Yeah.
But I do awesome. I like to be pretty transparent, and it's like, let's just kind of see, let's get real.
Yeah. With that being said, it just reminds me of, what you said earlier, those free consultation calls. It sounds like the potential client really has nothing to lose, right? By reaching out and just talking with you, seeing if you're a good fit, maybe just asking some basic questions. They don't have to commit to anything. It's just gathering more information before they take that next step. Does that sound about right?
Yeah, that sounds just about right.
Good. Agnes, what has been the feedback from clients about their experience working with you?
Mainly positive, which is a good thing. But most of the feedback I get is people like the depth-oriented therapy has been the feedback. And even though sometimes it doesn't feel very comfortable, there's growth from it. So they might not like me very much one week, and they come back the next week and they're like, whatever we talked about, whatever we brought up, it really helped me reflect and think deeper, and I kind of understand things a little bit better, or a little bit more that might be happening. So that's kind of mainly the feedback. And and we have fun sometimes too, right? Like I joke around, I use a lot of analogies. Like I usually don't do too much self-disclosure, but very occasionally I will. I like to really keep it about the client, and really only use it when necessary, when it's going to benefit the client.
Yeah, and that feedback, I think, is testament to the quality of service that you provide your clients. So kudos to you, Agnes, for being a great clinician out there. I like to switch gears and ask about you. Is that okay?
Yeah, absolutely.
So what motivated you to be a therapist in the first place?
It's been quite a journey to getting here, but I've always really been fascinated with how people work, right? The psyche and how we work and what drives us, what's kind of underneath. So my bachelor's is in psychology, and then my master's is in social work, which is a little bit broader, but just deep down, just always been fascinated by that. And I've always liked working with people. When I was younger, I've mentored. I actually wanted to be a teacher at one point. I studied early childhood education. So eventually I kind of got on this path and started to work. I worked out in a school setting, so worked with kids. I worked at a psychiatric facility. That was really interesting and really good experience. And then I joined private practice, and I just absolutely loved it.
Yeah. Wow. That's awesome. Agnes, what's on the horizon for your practice? Are you looking at maybe, hiring on some staff members, maybe publishing an online course or a coaching program? What's kind of the future look like?
Yeah. Well, so, and maybe I haven't mentioned this before. So I'm based out of California. And so right now I'm primarily seeing clients anywhere in California. I'm mainly telehealth, but what's also on the horizon is getting licensed in the state of Connecticut. This is actually kind of where I grew up. So going back there, and also getting licensed in North Carolina, where I have family as well. So that's kind of on the horizon, just some expansion in terms of doing therapy. And I mainly do individual therapy, and also I did forget to mention, I also do intensives, Brainspotting intensives. And those could be from anywhere from 3 hours up to 3 days. It really depends on someone's need. And we really develop kind of a plan on what we want to work on, what we want to move through. And we might be at it for, 1, 2, 3 days, depending how much stuff there is, depending how someone's responding to it, how fast they're processing, and so on. So those are my kind of 2 therapy offerings that I do under kind of Achieving Wellness Together counseling. And then I also have a separate venture, and that is actually facilitating retreats. So I have a retreat coming up in Sedona, Arizona this May. And it's women only. It's very small. It's going to be just 6 spots. And we're going to do some deep work. It's not necessarily going to be therapy, but I'm also have partnered up with someone who's a hypnotherapist. So we are going to do some brain spotting informed work and hypnotherapy and breath work and yoga and sound bath and exploring Sedona a little bit. So it's a very well-rounded kind of curated space for 5 nights.
Wow,
So that's another venture.
Yeah, wow. It sounds like you have a lot going on in your world, Agnes, and the retreat sounds amazing, and the intensives. I mean, I've just heard from clinicians who actually do intensives that they're amazing. Like sometimes doing the weekly tempo can be tough to sustain or to sustain progress because, right, like somebody comes in for an hour out of the entire week, and then they have a whole nother week before the next session maybe. And so a lot of stuff happens in between. And there's an old saying that goes that progress diminishes between therapy. And so it could be tough. And so I do know that those intensives can be a really great way to get that full immersion experience and really get a lot at once. Yeah. What are your thoughts on that?
Yeah, exactly what you're saying. And everybody, right, works differently. So for some people, chipping away on a weekly basis is kind of exactly what they need, and that works for them, and that's great. And for some people, like myself too, it's like not until end of session for me is that I get into it, right? I'm just getting started, and sometimes we're ending session and we're just kind of stepping into something really important. So the intensives really give us an opportunity to stay with it, to create the space and time for it and really process. So it could really open up this portal that we otherwise might not have the opportunity to open up in shorter sessions, or like you said, from week to week. There's a lot that happens from one week to another, but the intensives just give us such an opportunity to just work through so much. And yes, it's a lot of hard work, but it's so rewarding.
Yeah, I bet. Well, Agnes, if somebody wants to reach out to you to partner with you to do therapy, or maybe just to get more information about some of the other services that you have in the future, how can they do so?
They could check out my website, which is awtcounseling.com. And that's mainly for California people who want to reach out and do therapy. If someone's interested in retreats and some more of a coaching interest, then it's awtwellness.com. So kind of 2 separate ways to get in touch with me, depending what someone is looking for.
Awesome. Thank you for that, Agnes. And thank you for coming on the show today and sharing a little bit about you and your practice. It was really informative, and I really appreciate you coming on. And maybe we could do it again in the future. How does that sound?
Yeah, absolutely. And Rich, I wanted to show you Brainspotting a little bit more before we wrap up.
Let's do it. All right. Yeah, I'm ready.
Okay, right? Because someone hears Brainspotting, and I think it's maybe a little bit of an intimidating word, but I kind of want to show you how it works a little bit.
All right. Yeah. So, it's funny because I've heard and know of Brainspotting, but I've never actually experienced it. So I'm ready. Agnes, let's go.
All right. So, right, and this is kind of what it would look like. Well, let's just say we're working on something that has some emotional content or a memory that we're wanting to work through. So, Rich, I want you to think about something that maybe, spikes up your anxiety or just kind of feels uncomfortable, or you know what, it could even be something positive, because there's so many different ways to use Brainspotting. So, but just something that you notice your nervous system kind of responds to.
I got it.
You got it?
Yeah.
Okay. So, and you don't have to share it if you don't want to. And that's another great thing about Brainspotting, where you can if you want to. It's totally up to you. But
I'll share if that's okay with you. Yeah, it's heights. So I remember one time I was like doing like an obstacle course, and then I had to like get my body over, and I just remember this fear. And then whenever I think about that, I'm like, so yeah. And now with heights, anytime I'm like on a cliff or anything, I'm like, so.
Okay. So right. So you're noticing that, There's a sensation in your body that goes along with that, right?
Yes, ma'am.
All right. So I'm going to whip out my pointer here that I'm going to use. It's my magic wand. And all you have to do is notice and follow. And I'm just going to ask you, I'm just going to give you a little bit more space here. I'm going to ask you how that sensation of this, right, that fear, how does it feel when you look over here?
Right? Just thinking about it and then looking at it. Okay.
Yeah.
I feel it. I kind of still feel it in my.
Okay.
Yeah. Okay.
And now I'm just going to kind of check it. Notice how it feels around here.
Yeah. As you were moving it, I feel like it kind of went away in a way. Like as you were moving it, you know what I mean? And then when it was steady, I felt it.
It came back?
Yeah. Yeah. But it wasn't as strong, I think, as the first one.
Exactly.
Okay.
And then how is it kind of over here?
It feels like less, maybe lighter.
Okay. So with that, and I'm not going to go into it, right? We're not going to process with you here.
Okay.
But, right, that's information that it's more activated on this side over here for you. So we already know it's on this side. It's probably somewhere between here and there. So let's say if I come back.
Yeah.
And I'm gonna slowly move in and just notice what's happening. Is it still the strongest over there?
Yeah, it is. It was strongest where you started on the edge. Yeah.
And check this out. And what happens when I go down?
You know what? For me, Agnes, I feel like there's no change.
That's okay.
Yeah. I feel like it's just like steady on that side.
All right. And what happens when I go up? And it might not change either.
Yeah, same. Yeah, it's steady. Yeah, steady.
Because usually at the eye level is where we can capture the most. Gotcha. So let's say this is the spot right here. Again, I'm going to put it away because we're not going to do processing.
Okay.
Right? That means we're activating something. So that emotional content or that fear, whatever comes up, is connected to a place in your visual field. And it feels different, right? That's why it felt less on the other side. And we could work with brain spotting in many different ways. Sometimes we go from that activation place that feels heightened. And I always say, what goes up must come down. And it usually does. But sometimes if that be too scary, and then we might work from a place that feels a little bit less intense, and that works too.
Yeah, that's so interesting, Agnes, that the placement of the eye can indicate or signal like the feelings in the body.
Yeah. It's directly connected. It just targets different things. So
yeah, wow, that is so interesting. I'm gonna probably hit you up to content services, Agnes. Thank you for that. Now I gotta sit with this the rest of the day. No, I'm just kidding.
I'm sorry.
No, you're good. That was a great introduction because I've never actually experienced brain spotting or even EMDR. So I think there's some overlap between those two. But it was kind of cool just seeing it in action and experiencing it. So thank you for that, Agnes.
Yeah. Well, thanks for being brave enough to do that and letting me show you.
Yeah, absolutely. All right, everybody. Thank you so much, Agnes, for coming on. And thanks for everybody for tuning in on this episode. And until the next one, signing out.
All right.
Bye.
Thanks, Rich.